I will try to give some opinions of what can be done by the profession. We have talked about cost for cancer care, and I will not repeat too much, but increasing prevalence and incidence is a problem. And above all, the patients with incurable cancer disease are living longer. We need an effective multidisciplinarity. Most healthcare systems are not adapted, and therefore we have ineffectiveness in the healthcare systems. We have heard about the increasing number of biological subgroups of patients and the anti-cancer agents effective on small subsets of patients. Cost for drug development is increasing. The last figures we heard were $1.8 billion for a registered anti-cancer agent by the pharmaceutical industry. The healthcare system cannot afford new anti-cancer agents. Pharmaceutical industry is not paid back. That is another problem. How do we monitor clinical effectiveness of new cancer therapies? I think that's an important question for the profession. We lack information on the impact of anti-cancer therapies on the outcome in most countries. Assumptions of the effect of anti-cancer therapies are usually based on results from clinical trials. That is clinical efficacy. We need detailed data on clinical effectiveness. That's the effects of new therapeutic interventions on a population-based patient cohort. And the reason is that we have a variation due to individual factors: demographic, clinical, patient compliance, and health literacy and awareness. Institutional level factors, the characteristics of the providers, local access issues, national, regional factors like population health, healthcare systems, national, regional guidelines, regulations, and economy. We have a number of factors influencing this. We have to remember what is translational cancer research, and that is integration of the cancer research continuum. This conference clearly showed that we have are on the way to bridge the basic preclinical research and clinical research, that early translational research. More difficult is late translational cancer research, bridging clinical research and implementation and evaluation of innovations in the healthcare system, which is a prerequisite for adoptions by the healthcare system. So outcomes research is an obligatory part of the translational cancer research. I think that's an important message. For outcomes research and a complete outcomes research, we need the comprehensive clinical cancer registers. We need patients' characteristic tumor data, primary treatment or recurrent disease, outcomes of treatments, individual treatments, as well as integration of the complete clinical pathway, and we need the follow-up. So outcomes research here is also an important and necessary structure for health economy. It's not enough just with information about costs. We need cost effectiveness of specific treatment, comparative effectiveness research, cost effectiveness of the integrated clinical activities of the whole clinical pathway of a tumor disease, and the health economy should be seen as a part of the late translational cancer research. And this is an instrument for prioritization within the clinical pathway and between treatments. So what is lacking today? Today, research is lacking regarding clinical effectiveness, cost effectiveness, comparative effectiveness research, comprehensive outcomes research. And these are important components of late translational cancer research. And they provide the relevant information for healthcare systems to prioritize, and that is at present lacking. So therefore, we have taken a measure in the European Platform project you heard about, bringing together 23 cancer research centers in Europe, and we have a separate work package here, which now should structure an assay for clinical effectiveness for new anti-cancer agents on breast cancer and malignant melanoma as a start. And that is a part of outcomes research. For a more complete clinical cancer register on breast cancer will be the first step towards a comprehensive outcomes research structure in collaboration with the European Partnership on Actions Against Cancer. Both projects will involve several centers of the European Platform Consortium to reach an acceptable critical mass. So the message here is that we lack important structures for late translational cancer research. It's impossible at present for the healthcare system to prioritize. And we need to see this as a part of the translational cancer research continuum and go into this area. Then we will have a possibility to argue for new technology. And this is especially important since we are approaching personalized cancer medicine, because it will not be possible in future to evidence-based cancer medicine in the way we have done before. We need new types of clinical trials, new way to collect information. The detailed quality assured cancer registers will be more important, and we must use them better to collect the relevant information. Thank you.